Welcome to Independent RX Forum with the National Community Pharmacists Association, America's leading advocate and business education provider for independent community pharmacists. Independent RX Forum is powered by RX Connection.
Hello, and welcome back to the Independent RX Forum. My name is Brooklyn Morgan. I'm the Associate Director of State Government Affairs here at NCPA. And today I'm joined by our special guest, Dr. Anthony Pudlo, CEO of the Tennessee Pharmacists Association. Welcome, Anthony.
Thanks, Brooklyn. Thanks for having me.
Yeah. So you've had a very lively legislative session this year. Tell us a little bit about specifically your vertical integration bill that you've got going on.
Yeah. Thank you for having me. And it has been quite the lively legislative session, and not just due to that bill, but really the multiple bills that any state association always is monitoring. But regarding the vertical integration bill, actually Senate Bill 2040 or House Bill 1955 actually came forward out of some concepts by one of our pharmacists that serve in the state Senate, Senator Bobby Harshbarger. Some folks might be familiar with that name, as Bobby's mother is one of our pharmacists serving in Congress. But Senator Harshbarger brought forward this concept actually late last spring, after we saw what was happening in Arkansas and the success that they were having. And so throughout the summer and into the fall, we started working more closely with Senator Harshbarger and other pharmacist champions in the state Senate to say, what can we do to bring something like this forward? And yes, throughout session this year, we have been very pleased with the amount of support that we've seen, both on the Senate side as well as in our state House. But very similar to what Arkansas did, what this bill is doing is it's empowering our Board of Pharmacy to more or less say that they cannot issue a pharmacy license to a business if that business is either a health insurance issuer and a PBM. So really trying to get at that true vertical integration due to the many concerns that we've seen in the industry. Happy to get more into those details in a sec, but we're just really pleased to see this bill come forward, and really the association has been supporting it throughout the process.
Yeah, awesome. Thank you for that overview. Tell us a little bit about why you felt that this was valuable for your members.
Yeah, I think for us, and I speak quite closely with my colleagues in a lot of other states and also at the national level on why Tennessee was ripe for such legislation. For us, I think what really spurred this movement was actually back in 2022, Tennessee adopted a law that allowed our Department of Commerce and Insurance to audit PBMs on a regular basis. And we're aware that our insurance commissioner on any given year is auditing at least 5 PBMs. And really in the last year and a half, we've actually seen a lot of that work come forward. Last year, there was an audit report that revealed a lot of concerns around Express Scripts. Primarily, I would say not only the ideas of them paying their own affiliated pharmacies at a much higher rate than other non-affiliated pharmacies, but also the amount of money that is being siphoned out of the system through spread pricing, which has also been illegal in the state of Tennessee. But here, most recently, in 2026, we saw an audit report came out on CVS Caremark, and I would say that was probably the most telling. That was probably the most egregious audit that we've seen, where CVS Caremark was paying some of their own affiliated pharmacies in certain situations upwards of 16,000% more than other non-affiliated pharmacies. Similarly, we saw them not complying with our PBM reform laws that have been on the books for years, and just an overabundance amount of non-compliance with the law. So it was more than enough evidence, I think, for our legislators to say we need to move this forward. And we have now seen, I'd have to double check the numbers, but I think we've seen 9 co-sponsors on our Senate bill. And I think we're just shy of 30 or just over 30 sponsors on our House bill. And on both sides, that includes our Speaker of the House, as well as our Lieutenant Governor, who serves more or less as our President of the Senate as well.
Awesome. Yeah, we've really seen this as a bipartisan issue, and it's getting a lot of support, so it's great to see.
Mm-hmm.
Speaking of CVS Health, we've seen a big campaign from them talking about pharmacy closures. Can you tell us a little bit about why this bill is not requiring pharmacies to close and what that campaign has looked like in your response?
Yeah, it's been interesting. We have seen CVS Health come out uh, with quite a heavy PR campaign on a few different levels. There's been some direct messaging about opposing the bill. They've also come out with messaging that showcases that they're here for Tennessee and trying to show, why they more or less belong in the state. What we've really been showing is that there's nothing in the bill that requires a pharmacy to close their doors, but they really have to choose whether they want to be a PBM and looking out for their profits that are coming from their PBM, or do they want to be a pharmacy and care about the patients of Tennessee? And so our messaging has been very clear. Now, TPA itself, we've been kind of running our own little mini campaign, nowhere near the amount of money that I think CVS Health has poured into theirs, but we've been really trying to unmask the middleman in this whole thing and showcasing some of that data that we've seen, not just at the state level, but what our other state colleagues have seen, what we've seen at the federal level, and showcasing why this is needed. But yes, I think the latest numbers and figures we've seen from the opposition, it was recently published close to $5 or even $6 million that had been poured into a campaign of fighting the bill. And it's been interesting. Even in some of their testimony, they will talk about the various components of CVS Health that may have to close because of this, whether it's their warehouse or if it's their minute clinics. And I think even our legislators have seen through that and saying, you know what, this bill is focused on the pharmacy component, and your pharmacy will have a choice on how they want to do their business. If they want to be a pharmacy, then be a pharmacy, and if not, then you're welcome to close your pharmacy's doors, but the rest of your building can still stay open and function. And so, yeah, we've definitely seen that. We've also seen them even paying social media influencers. I think it was revealed actually by our Speaker of the House retweeted a screenshot that we saw. They've been paying social media influencers upwards of $13,000 to carry their message. So we have had quite the battle. But I think for us, what we continue to see is the grassroots matter. Our members and the relationships that they have with their local legislators, both in the Senate and the House, have really prevailed. And we have seen a great amount of support for the bill, and it is because of those local relationships that matter.
Yeah, it's really incredible to see what all you've been able to do. You may not be able to match the dollar amount, but
Mhm.
when the content really matters, it shows, and you've done an incredible job with that. So thank you for all of your hard work. Speaking of resources, I wanted to touch on our new program that NCPA has put out, the State Panel of Experts. This is a program that is not in any way meant to replace all of the hard work that you do. You do such an incredible job, but really to just enhance that reach.
Mhm.
It's sponsored by the Compliant Pharmacy Alliance, and we are very grateful for their financial support of this program. So just tell us a little bit about what you've utilized them for and how that's been.
Yeah, over the years, as we were even alluding to, I think state pharmacy associations, with the limited resources that we have to rely heavily on our colleagues, both in other states as well as at the national level. And there's always been as you well know, always a great synergy that comes from that relationship. But I do think this program that NCPA has been able to provide states, primarily for us, it's been some of the legal counsel that has been really helpful because I think we work very closely, and as a neighboring state to Arkansas, are very keenly aware of what their bill did and how it was written, as well as some of their legal challenges that they're facing with what they passed. And I think our legislators are very curious in making sure that we do this the right way moving forward. And so for us, we've been very pleased to be able to have the support from NCPA, to have some additional legal counsel in not just reviewing some of our original bill language, but also thinking through some amendment language. But also, how do we make sure, because this bill is probably still going to be litigated, but how are we making sure that we have the best success when that happens? And so we've been very, very fortunate for that legal counsel. I think it's going to help pay off in the end for us moving forward. And so for us, it really has been a lifeline, not just for myself, but our primary lobbyists that I work with as well. So we can have comfort as we approach our legislators as well as our attorney general, saying, here's the kind of bill language that we feel is the strongest for this issue.
Yeah, it's great to be so have so much forethought and thinking ahead of what's down the road as well. For other states who are potentially looking to do a similar bill in their state, what advice do you have for them in this process?
Ooh, I wish I had all the best advice. I think for us, and I do have these conversations with my other state colleagues, is sometimes you have to wait for the stars to align. We definitely have had strong support, both by our legislators in the House and in the Senate, and a lot of pharmacists are actually even serving in our General Assembly or spouses of pharmacists. So, you kind of want to have all those right pieces, whether it's a direct pharmacist or a spouse or some key champions to carry this forward. I think for us, as I was saying earlier, we had the data. We had the data to prove that this was needed, and not to undermine all the things that are happening nationally in other states. But I know our legislators were very keenly aware of what Tennessee was seeing and why we needed to do it. So for us, I think I tell states, make sure you have not just your legislative support, think through all the other pieces that you need to have in place to make this happen. So for us, like I said, that audit language actually passed now 4 years ago. So you have to think about all these other stepping stones that you need to get to have the most success with such of a bill moving forward. But I do still think having the conversation helps. I think we've seen a handful of states bring forward similar bills already this year to just start teasing the concept. But I do think that helps, but also you're going to need some of these other moving parts to help you carry that message forward. And like we said, I think be ready for a PR campaign of some kind. It's going to be needed. The opposition is going to come out hard to oppose such a bill. So yeah, you kind of need all stars to align, but there's, I think, a lot of great resources between what our national colleagues have, what other states have, to really help the state move things forward and be successful.
Great. Well, thank you so much, Anthony, for joining us today on the podcast. You can catch our next episode wherever you listen.